These 6 types of infection cannot be cured. Before you quarrel with me in the comment box, please calm down. Let me explain. If you have these 6 types of infection and you do not do what I'm going to be listing, believe me that that infection will not be cured. So before I list them, if you have not subscribed, please help me click the subscribe button. Help me like this video. You can share it to people out there so that they will be aware, just the way you are going to be aware of the 6 different types of infection and why they cannot be cured and what to do. All right, I'll list them hand in hand so that the video will not be so extensive. So first of them is drug-resistant infections. What are drug-resistant infections? Drug resistance is a situation whereby that infection you are targeting to cure has developed resistance, whereby the effect, the efficacy, that is the power of that drug, no longer have effect on it. It's just like when a parent keep beating the child. One day the child will develop this thick skin that no matter what he or she does, after all, is it not just beating? That is how it happens in infection. There's a stage you keep using one medication. Each time you are sick, you feel it's infection. Each time that you have headache, you feel it's infection. And the first thing you run to is antibiotics. As you keep loading your system with these antibiotics, there is a day that your body will develop resistance to them. And when the real infection has come for you to use antibiotics, your body will not respond well to it. And then there will be poor treatment or the unexpected can happen. So that is the number 1 type of infection that cannot be cured. The second type of infection that cannot be cured has to do with non-compliance clients. So those persons that do not take complete treatment or will not comply with the treatment, they are not consistent with the treatment just the way the doctor prescribed it, possibly because of the side effect, possibly because of how they feel, possibly they say they have not eaten. Some of them will tell you, I have not eaten, that's why I did not take the medication. So one of those reasons might be the reason why they are not complying to the time, to the dose, and also to the prescribed route they are supposed to take it. So if you have this kind of attitude, know that that infection will not be properly treated. So infections or treatment of disease conditions, the efficacy or the efficiency of that treatment depends on the right dose, the right time, the right route. So do not play down on this information. If not, you'll only be carrying an infection that cannot be treated. So don't know more than your physician. When you're having side effect, please report back. Report back so that if there's need to adjust the dose or change the medication, they will do so. The third kind of infection that cannot be treated has to do with wrong use of medication. Okay, now this has to do with persons that uses mostly over-the-counter drugs, people that self-medicate. If you have that attitude that anytime you are sick, you don't go to look for prescription, you don't visit the hospital, you don't do lab tests, trust me, there are different types of infection. There are different things that can cause infection. We have viral infection, we have fungal infections, we have bacterial infections, and the rest. So it depends on the type of infection. The word infection simply means proliferation of microorganisms. That is what it simply means. Proliferation of microorganisms in the body system. That is what we mean by infection. So don't confuse it for every symptom that you have. And then all you do, you run to take the medication that comes to your mind. The fact that one medication have worked today does not mean it will work tomorrow. So stop self-medicating. Because there are people that will say 2 paracetamol is not enough for me. So they'll skip it up to 4, they'll push it up to 6. There is a day you will take a dose and then it will be a lethal dose. Because as you keep increasing, your body will develop tolerance. But that does not mean that the toxicity dose, the toxic dose is not actually increasing. The toxicity line is not increasing. So don't set up yourself for poisoning. Ensure you seek the doctor's advice before you take any medication, whether antiviral, antibiotics, antifungal, any kind of medication. The fourth kind of infection that cannot be cured have to do with returning infection or re-exposure infection. Now, this have to do with people that have mostly poor hygiene. It's just like when you have a wound in your hand, you go and hit it on the wall. The fact that you are taking medication does not mean that the wound would heal. Because as long as you keep hitting the wound on the wall, you keep exposing the surface, you keep exposing the skin to more bleeding, and the wound will expand. So that is what it is when you have poor hygiene, where you know that this is the person that got infected, this is what got infected, you return back to that thing. So if you have this kind of practice, you do not practice protected sex, you do not practice hygiene, in terms of handling blood equipment or blood content or organs of the body, fluid, blood contained fluid or infected fluid, you can get yourself infected again. You share sharp objects, you can get yourself infected again. So anybody that practice this kind of lifestyle, anybody that is not careful with things that causes infection, have the tendency to have a reinfection or a co-infection where other infections are now reintroduced into the system. And with this kind of infection, you cannot cure it. So you need to change your attitude first for the treatment to be responsive. The fifth kind of infection that cannot be cured has to do with denial and delayed treated infection. Denial or delayed treated infection. You know, most people, because of the stigma attached to certain disease condition, they are scared of having it. And because of that, because they don't want to pass through public scrutiny, they will rather bear the pains, bear the symptoms. So this kind of infections may not have cure, because before they will present, it will be late presentation. Before they come to seek help, it has already entered chronicity or there is already complication. So that's why you should break out of that stigma, break out of that fear. Stop living in denial. Go for checkup before you treat yourself. The last but not the least kind of infection that cannot be cured have to do with infection that are treated by non-professionals. This day, one of the greatest things society is suffering, especially the third world, has to do with the advice that is coming from non-professionals. This can be coming from the act of negligence or malpractice. So instead of you to run to an auxiliary nurse, auxiliary doctor, please go to a good and quality hospital. Don't just have the attitude of always running to chemists. Any small headache chemist, any small headache chemist. Please run to a professional, especially when you see symptoms that are unbearable. Because most of these persons, what they are looking at is the money they'll make out of it and not your recovery. So don't stake your recovery with someone's quest for resources. Go for a professional treatment. Seek the help of a professional. I think with this, every kind of infection can be treated and can come to cure if they are early diagnosed, if there is no drug resistance, if there is no delayed presentation, if there is no non-compliance, if there is no aspect of you seeking help from non-professionals. Every kind of infection can be treated. So if this particular video actually makes sense to you, it's actually educative, please help me share it to other people. There are people who need to hear this information. Help me share it to them. I hope you have liked the video. If you are yet to subscribe, please help me click on the subscribe button so that whenever we release beautiful content like this, you'll be among those persons that will actually be the first persons to view it and to watch it. Alright? I look forward to that moment where this particular channel becomes your most favorite click. But for now, stay safe. Cheers.